Welcome back to SDSU as we prepare for the spring 2021 semester. This video provides information about COVID-19 and also infection prevention and the testing policy at SDSU. It is crucial for members of our community to understand these guidelines and policies to help prevent the spread of COVID-19. SDSU policy requires that all individuals on campus wear a facial covering and practice physical distancing, defined as 6 feet or more. Facial coverings should cover both your nose and mouth. Make sure you have a comfortable covering that is tight-fitting. In addition, it is recommended to wash your hands with soap and water before touching or removing your facial covering. Remember to remove your facial covering by holding the ear loops or ties. The CDC recommends having multiple face coverings available so you can replace your facial covering frequently. This is recommended for both disposable and reusable facial coverings. Physical distancing entails maintaining at least 6 feet between you and the people who live outside of your immediate household. You should practice these measures in all settings, including times you are taking personal breaks and when you are off campus. SDSU's goal is to slow the spread of the virus within our community so we can ultimately get back to in-person courses. This goal will take the commitment of all members of our community. The facial covering and physical distancing guidelines will be in place for the entirety of the spring 2021 semester. Next, let's quickly review symptoms associated with COVID-19. It is crucial for everyone to recognize these symptoms. Symptoms include cough, shortness of breath, difficulty breathing, high fever, chills, sore throat, body and muscle aches, nausea and vomiting, runny nose, new loss of taste or smell, and fatigue. Symptoms may appear 2 to 14 days after exposure to the virus. An individual with COVID-19 is contagious to others in the 2 days before they develop symptoms and throughout their illness. It is also possible for an individual to be asymptomatic, meaning they are infected with COVID-19 but do not experience or show any symptoms. Even a person that is asymptomatic can still spread the disease to others. Next, let's discuss the quarantine process. The purpose of quarantining is to separate and restrict the movement of people who are exposed to a contagious disease and see if they become sick. Quarantined individuals may have been exposed to COVID-19 and did not know it, or they may have the disease but do not show symptoms. It is extremely important that people quarantine for the full length of time they are advised to do so by their healthcare provider or county health department. This is typically for a period of 14 days, though it may be shorter with the addition of a negative test if the county health department allows. You should always follow the guidance of health professionals. This is especially important after traveling or attending any sort of gathering with individuals outside of your immediate household. It is a good thing if you are not experiencing any symptoms while quarantining, but do not end your quarantine period early because you could be asymptomatic. The CDC defines a close contact as someone who is within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period. All SDSU students will be required to quarantine if they come in contact with a COVID-19 positive individual, unless they have tested positive within the last 90 days. You should not attend class or spend time with any other person if you are experiencing any COVID-19 symptoms. Stay home or immediately go home if you start experiencing symptoms. If you are registered for an in-person course and are experiencing COVID-19 symptoms, do not return to class until at least 10 days have passed since symptoms first appeared, and there's been an improvement in symptoms, example cough, shortness of breath, and at least 24 hours have passed since your last fever. Again, this is extremely important for preventing the spread of COVID-19. If you are quarantining or diagnosed with COVID-19, contact your instructor to inform them of your situation. Communication with your instructors is key. Update them on your situation to ensure absences are accounted for and you have clear instruction for making up assignments. Next, let's review COVID-19 testing. There are a few testing options available for SDSU students. Students can get tested through SDSU Student Health Services, the San Diego County Health and Human Services Agency, or their primary care physician. Student Health Services offers COVID-19 testing at the Cal Poly Center. SDSU testing is available Monday through Friday, 8:30 a.m. to 4:30 p.m., and Wednesdays, 9:30 a.m. to 4:30 p.m. For all current students with a valid Red ID, there is no cost for testing. Please note this is a testing option available by appointment only. We recommend that students schedule tests in advance to avoid any time conflicts and so that they can meet testing deadlines for on-campus housing and/or in-person courses. Online scheduling is available through Healthy Connect, SDSU's secure online health portal. Students will be asked to self-collect their test specimen with a nasal swab on site. This will be observed by an SHS team member in order to ensure you are doing it correctly. Results are typically available in 2 to 3 days and will be sent out via Healthy Connect. When you receive a test at SHS, the result will automatically be uploaded to your Healthy Connect account. If a student tests positive, they will also receive a follow-up phone call from Student Health Services. The San Diego County Health and Human Service Agency has a testing center conveniently located at the SDSU Alumni Center. This testing location is open Monday through Friday from 8:30 a.m. to 4 p.m. The Alumni Center offers walk-in testing with no appointment needed. If you receive a test at any other location besides Student Health Services, you will need to personally upload your results to Healthy Connect. Please note if you get tested at an off-campus site, it must be a molecular, PCR, or TMA test. Antigen and antibody testing will not be accepted. Results are typically available in 2 to 3 days and will be sent out via Healthy Connect. When you receive a test at SHS, the results will automatically be uploaded to your Healthy Connect account. If a student tests positive, they will also receive a follow-up phone call from Student Health Services. As previously stated, there are many testing options available to SDSU students. We want to ensure that you know how to upload and verify your results. If you test through SHS, the results will automatically be uploaded to your Healthy Connect account. For those who have decided to test off campus through San Diego County Health or other healthcare providers, you will need to personally upload your test results to Healthy Connect once you receive them. When uploading your results, ensure the file type is one that is accepted by Healthy Connect and ensure there are no special characters in your file name. Letters and numbers work best when naming a file. If you're having trouble uploading, please seek help by emailing covidcaseresponse@sdsu.edu. Regardless of where you were tested, please give yourself the necessary amount of time to receive results before returning to in-person classes. We recommend you get tested at least 3 business days before clearance expires in order to remain eligible to attend in-person classes. COVID-19 test results take between 1 and 2 days to process once they are uploaded to Healthy Connect, meaning there will be a delay between when your results are accepted and when your clearance status will change in web portal. Lastly, we want to remind you to log into your account with your SDSU issued email address rather than a personal email address. Students who reside in on-campus housing and/or attend in-person courses or research are required to get tested every 14 days. Failure to test as scheduled may result in a directive to quarantine or isolate until testing can be completed and/or the inability to attend in-person courses at SDSU. In addition, students may face student disciplinary consequences, including suspension. As a reminder, when students choose to participate in student housing, they agree to abide by the terms set forth by the Housing License Agreement, the COVID-19 Addendum, and the COVID-19 Notice of Disclosure. Students are responsible for their actions within a community and the impact those actions can have on others. Students are asked to continue to be responsible and considerate of their community. The COVID-19 vaccine is currently being administered to healthcare workers and to other essential employees. The COVID-19 vaccine helps our body develop immunity to the virus that causes COVID-19 without us having to get the illness. Different types of vaccines work in different ways to offer protection, but with all types of vaccines, the body is left with a supply of memory, T lymphocytes as well as B lymphocytes that will remember how to fight the virus in the future. It typically takes a few weeks for the body to produce T lymphocytes and B lymphocytes after vaccination. Therefore, it is possible that an individual could be infected with the virus that causes COVID 19 just before or just after vaccination and then get sick because the vaccine did not provide enough time to provide protection. The vaccines that currently have approval in the United States require 2 doses in order to be effective. Individuals will need at least 21 days between each dose in order for the vaccine to be effective. The vaccine news is promising, but we need to look at when the vaccine will be available to the majority of the SCSU community. Most reports indicate that the vaccine will be introduced to the general public and to younger adults at a later vaccination phase. It is critical that our community continue to follow guidelines such as wearing facial coverings and social distancing as we work through the various vaccination phases. These guidelines will be in place for the entire spring semester. If you'd like to receive an estimate on when you're likely to be eligible for the vaccine, Visit the brief online questionnaire. Next, let's address students returning to campus for in person instruction. Students returning to live on campus will be required to quarantine in their rooms upon their return on Monday, January 18th, with an SDSU stay at home advisory order. Meal plans will reactivate on Monday, January 18th. Students will be required to have one negative test to exit quarantine and must be tested twice in their first week back on campus, and then weekly for 2 weeks before returning to the regular 14-day testing cycle. In-person instruction for spring 2021 courses will be delayed for 2 weeks after the first official day of classes. This will allow the university to implement a robust testing program for students returning after winter closure to help reduce the potential spread of COVID-19 cases. Students should expect their first in-person class to begin Wednesday, February 3rd, and will need to have a negative COVID-19 test uploaded and verified in Healthy Connect to enter the classroom. Thank you for watching this video. We hope you found this information helpful. You can stay up to date on the latest information through the SDSU COVID-19 Weekly Digest. The next email is scheduled for Wednesday, January 22nd. In the meantime, you can reach out to SDSU with any COVID-related questions or concerns by emailing COVID-19 inquiries at sdsu.edu.